Hi, my name is Kelsey. I'm a nurse practitioner student. I'm going to be doing a head-to-toe physical assessment today. It may take about 30 minutes or so to use your restroom before we begin.
No, I'm fine, thank you.
Okay, I'm going to start out by asking you a few questions. Can you tell me your name and your birthday?
My name is Jessica Bridge. My birthday is September 15th, 1986.
And where are you at right now?
I'm at home.
And what is the date, including the year?
It is Sunday, January 22nd, 2017.
And who's the president?
Donald Trump.
And what would you do if you saw a building on fire?
I would call 911. Call for
Okay.
help.
Patient is oriented ×4. She's alert. Speech is clear. Mood and behavior are appropriate. She is dressed appropriately for the weather. I'm just going to have you take a few steps here and then come and sit back down.
Okay.
Gait is steady. Judgment and reasoning were also intact by asking what she would do if the fire or if the building was on fire. I'm going to take her vital signs here. I'm going to palpate her blood pressure. Okay, palpable systolic was 106. I'm going to check your pulse. We'll check it for a full minute. And it should be between 60 and 100. And count your respirations also for a full minute. And they should be between 12 and 20. And I will check your temperature. Okay, and it's 98.6 axillary. I'm going to start out by looking at your head. Head is symmetrical. No masses or lesions are noted. Hair is evenly distributed. Skull is normocephalic. Take a look at your eyes here. The eyes are symmetrical. The eyebrows and eyelashes hairs are evenly distributed. I'm going to take a look at your sclera. Sclera is white. Conjunctiva is pink and moist. I'm going to have you take a look at the letters on the wall. Have you hold this card about 12 to 14 inches away from your face, covering one eye, and read the line you can read.
EFPQRZ.
And the other eye.
EFPQRZ.
And then both eyes.
EFPQRZ.
Okay, vision is 20/20 bilaterally. Okay, I'm going to shine a light into your eyes. Just look straight ahead. And look at my pen light. And look at the wall. And the light. And the wall. At this time, I would use the ophthalmoscope to check the red reflex. I would use my right eye and look at her right eye. And the red reflex would be noted if the red light was shining. Pupils are equal and reactive to light. They accommodate. Direct and consensual response are noted. Pupils were a 3. Okay. I'm going to palpate your sinuses, the frontal, and maxillary. Any tenderness?
No.
Okay. Go ahead and look at your nose. Your nose is symmetrical. The mucosa is pink and moist. Terminates are present. And the septum is midline. Have you put one finger over one nostril and breathe in? And the other side. Nares are patent. Okay. And we'll go ahead and look at your ear. Palpate the pinna, mastoid, and tragus. Any tenderness?
No.
On the other side. Any tenderness?
No.
At this time, I would use an otoscope to look into her ear. I would use this hand to rest on her forehead and have the otoscope here, and I'll pull the pinna up and back, and I would look in her ear. The ear canal would be clear, tympanic membrane would be pearly gray and translucent. Okay, I'm going to go ahead and do the whisper test. Just have you cover your right ear.
Basketball.
Go to the other side. Cover your left ear.
Basketball.
Okay. Pass the whisper test. Go ahead and move on to your mouth. Lips are symmetrical. Go ahead and have you open your mouth. Say ah.
Ah.
Lift your tongue up. Okay. Tongue is midline. Uvula is midline. Teeth are present. No caries noted. Gums and oral mucosa are pink and moist. Tongue is midline. I already said that. Okay. Go ahead and move on to your neck. Go ahead and trachea is midline. No masses or lesions. Go ahead and empty swallow. Thyroid is non-palpable. Go ahead and feel your pulses. Carotid pulse is a 2+. Use my stethoscope to listen for bruise. Bruise are noted bilaterally. Okay, go ahead and palpate your lymph nodes. I'll have you turn their head that way a little. Preauriculars in front of the ear. Postauricular behind. Occipital at the back of the head. Tonsillary, submandibular, submental, posterior cervical, superficial cervical, and deep cervical chain, and then supraclavicular. Okay, go ahead and look at your upper extremities. Her upper extremities are pink, warm, and dry, with no lesions noted. And go ahead and check your pulses. Radial pulse is a 2+ bilaterally. Brachial pulse is a 2+ bilaterally. And go ahead and check your capillary refill. It is brisk in less than 3 seconds, and the nail angle is 160 degrees. And we're going to go ahead and stop at this time and then start on part 2.